Have you ever looked at someone and thought, they're just being dramatic, or, that's just how they are? What if I told you, some everyday behaviors we brush off as normal might actually be signs of something deeper, signs of mental illness? Let's talk about them, not to judge, but to understand, and maybe help someone in need. Overthinking seems normal, right? We all do it before big decisions. But constant overthinking, especially when it leads to sleepless nights, self-doubt, or paralysis in making even small choices, could be a sign of anxiety disorder. Workaholic, always grinding. Some wear it as a badge of honor, but being constantly busy to avoid being alone with your thoughts. That could be a sign of high-functioning depression or emotional avoidance. Everyone needs space sometimes, but when someone consistently isolates themselves, avoids friends, and loses interest in things they once loved, that's not just me time. It could be clinical depression or social anxiety. Short temper, easily frustrated. These aren't just personality traits. Frequent anger or irritability, especially without clear cause, may point to bipolar disorder, PTSD, or chronic stress overload. They're always making people laugh, always the life of the party. But sometimes, humor hides pain. Joking constantly can be a mask for depression, low self-esteem, or childhood trauma. Mental illness doesn't always look like sadness or breakdowns. Sometimes, it looks like success, like silence, like strength. The truth is, we never really know what someone's battling inside. So let's be kind. Let's ask, are you okay? And mean it. And if you see yourself in any of these signs, there's no shame in asking for help. You are not alone.